Loisel, and as a Jewish woman, I'd like to say that the tone of this debate has been increasingly disturbing to me. I've been thrilled. Thank you for managing this so beautifully. I'm asking at the federal level what both parties are doing to tone down the tone, and the issues of healthcare reform being equated with Nazism is very disturbing to me. Also, if in fact this bill is pushed down, I'd like to know what kind of timetable the Republicans are thinking about in order to capture at least this public debate that has begun. I'm afraid in 36 years we're all going to be standing here again.
Thanks. Appreciate it. Yes, sir. My name is Matt Geary. Just to follow up on what that young lady had to say first, Tom, thank you for doing this. Congressman Cantor and Scott for being here. My concern is primarily with the rhetoric out of Washington. It has gotten, as she said, it's gotten increasingly ugly, and that gets us absolutely nowhere. I learned in kindergarten to be nice. To get to the 20% that the two of you do not agree on. If everybody in Congress would follow your model, you're two of the smartest, most well-respected leaders of your parties. If the rest of those folks would follow your model, I think we would get to that 20% and ultimately find some solution to this problem, so we're not back here in 36 years talking about it again. So thank you all for today, at least, starting out without the rhetoric and the ugliness. That's how we're ultimately going to come to a solution, I think. So I just wanted to say thank you both. Thank you.
Hello, my name is John Lathrop, and yes, I want to thank you for giving me the chance to talk, because the last time I tried to ask this question, I was shut out. 45 million people thrown in the system right away. You have no new doctors, no new hospitals. The only ones that are available are the VAs, and we're already being rationed. Where does that leave the veteran? Now, the last time I tried to ask that question, I got shut out at Mr. Scott's town hall. And I was also wanted to ask the question, why didn't he have a salute to that flag out there before? And when I went up there to ask that question, a bunch of union workers booed me. So I would like an explanation from Mr. Scott why that happened, plus an answer to my original question.
Okay, thanks for your question. We're set up here. We ended with a series of questions just to make sure that everybody would stand up. Thanks for that. Anything you want to take from the questions as a closer?
First of all, I want to thank you again for being here. I do think this should serve as a model around the country. I do think if we could have a forum like this in all 50 states, we'd probably be an awful lot closer to getting to where we could affect positive reform. So thank you for your participation. I want to thank the veterans here for all you've done for our country and will continue to do. We, I think, take very seriously our obligation on both sides of the aisle to provide for veteran care after all you have done for us. I just want to respond to Mr. Vanderpool's question about whether if a public option is passed, would members of Congress have to live under it? Well, this was an interesting point that we made and tried to discuss in the Ways and Means Committee, because as you can tell by now, I am not a supporter of a public option because I believe it will become the only plan over time. So we proffered an amendment to say, if this goes into law, will you, and Bobby was not on this committee, so I can't impugn him with this, but will you say that all members of Congress have to live under that same plan? And it was resoundingly rejected. But what's fair for this country has to be fair for members of Congress. So I can tell you, in all seriousness, this has been a very helpful discussion for me, and look forward to continuing. Thank you, Tom.
Thank you, Representative Cantor. Representative Scott, any closing comments?
Thank you, and I'd like to thank you, Tom, for the opportunity to participate in a debate where information can actually be exchanged. I think several people have talked about the tone of the debate, and I think this is probably the best opportunity we've had to talk about what's really in the bill, what the differences are, where we agree and where we disagree. We've had a number of comments. One is we have to emphasize that this is an option. People have asked whether or not we would serve under it, whether or not we would be under it. If you have employer-based coverage, no one would be able to get into the exchange if they're already covered with a qualified plan, that is one that meets the minimum standards. They will not be able to get into the exchange. Over the course of time, larger and larger employers, so that there's not a rush into the exchange and it's overwhelmed, would be able to access the exchange. Frankly, the exchange looks like what we have as federal employees. And there's no congressional plan. We're federal employees and get what the same all federal employees get. The only difference is that we do not have a public option. For people like Eric and myself, I might well choose the public option because it's more likely to have physicians on board that are in Newport News, in Richmond, in Washington, and if we're traveling somewhere else and get sick, I'd like a physician that's on a panel. So it might, in fact, be a good choice for us. We're talking about what happens if with the VA. Thank you for your service. I would point out in the last couple of years we have had significant increases in funding for the VA. It's not enough. It needs more, and we're going to continue going in that direction because people who have served our country, risked their lives, if you have, deserve the best health care that we can possibly provide. That is unconscionable, and the fact that if you have an appeal, you have to wait so long to get a straight answer, that is unconscionable. We have, because of the increases we've had, hired significantly more people to deal with veterans' appeals than we've had in the past. We haven't finished. We're going to continue to improve it. But the major question before us, since we agree on the 80%, is to recognize that you can't do the 80% without the 20%. You can't do a pre-existing condition unless you've got universal coverage, so people don't wait till they get sick. You can't have an exchange because most states have pretty much a sole source. You can't have people forced to buy a product without a meaningful check on prices, check on quality, and that's where the public option comes in. If you do not have a public option, you just can't eliminate it. You got to put something in its place to be a meaningful check on prices. And that's why the public option is there, and that's why it's so essential, because otherwise you're requiring people to buy from a for-profit, sole-source corporation with no check on prices. And so, Tom, thank you very much for bringing us together, and thank everyone for the questions.